Hello, future doctors. How are you all? Welcome back to MedSteps ECG series by Dr. Anand. So, in our previous lecture, we learned about normal cardiac axis and how to determine it using lead 1 and lead AVF. So, today we will learn the most important, that is left axis deviation. So, the left axis deviation is one of the most frequently tested ECG topics in FMGE and MBBS and the NEET PG. And if you are doing any end rotation cardiology or internal medicine department, in ASCII they are going to ask this type of questions. By the end of this lecture, you will be able to identify LAD, left axis deviation, in just a few seconds and understand its common causes. Okay, so without time waste, let's begin. So, what is left axis deviation? If you're seeing here, normally the electrical impulse travels downwards and slightly to the left. Okay, so here when the electrical axis shifts more toward the left than normal, then it's called left axis deviation. In definition, you can see here this left axis deviation means the QRS axis will be like minus 13 degrees, minus 30 degrees to minus 90 degrees. So always remember the normal axis is minus 30 degrees to plus 90 degrees. And in simple analogy, you can see here, imagine a compass. Okay, so you can see this thing. So imagine a compass, and normally the arrow point downwards and slightly left. In the arrow turns much more toward the left, that represents left axis deviation. Simple. Okay. So how to identify? Whenever you are seeing any left axis deviation, we have how to identify means we have to use the quickest ECG method. Then that is, we have to look at lead 1 and lead AVF. Okay, so in lead 1 and lead AVF, if lead 1 is positive, if it's going up, then it's positive. If the AVF is going down, then we call that is negative. So if it's lead 1 is going up positive and lead AVF is negative, then we have to think left axis deviation. And think here, um, so one arrow is going up and one arrow is going down. So here this both arrows are going away, that means lefting. So that's why we call that is left axis deviation. Like this also you can remember very easily. Okay, so in memory trick we have one trick, that is lead 1 will be like positive, lead AVF will be like positive means it's normal, if it's negative we call that is left axis deviation. So the positive lead 1 and the negative AVF equal to we call left axis deviation. Why does this LAD why does left axis deviation occur? The electrical impulse is redirected and move toward the left. Okay, more towards the left. That's why the patient will get left axis deviation. So this happens because the left ventricle becomes dominant and the left condition pathway is altered and electrical activation of the ventricles will changes. Okay, so this common causes of left axis deviation. So this common causes of left axis deviation. Here let's discuss the important causes of one by one. Okay, so first one we can see here, left ventricular hypertrophy. So whenever patient have left ventricular hypertrophy, the most common cause, the left ventricle becomes thick and more muscle mass means more electrical activity. So the electrical axis shifts toward the left. Okay, so because of that thing, you can see the main causes will be like of left ventricular hypertrophy, hypertension, aortic stenosis, and hypertrophic cardiomyopathy. So next you can see that is left anterior fascicular block. So this left anterior fascicular block also can cause left axis deviation. This is one of the most common ECG causes of left axis deviation. Okay, so what it will do? The left anterior fascicle is blocked. The electrical impulse travels through the left posterior fascicle first. This shifts the axis to the left, and the main point is the left anterior fascicular block is the common cause of left axis deviation. Next, you can see here that is inferior wall of myocardial infarction. So, a previous inferior wall myocardial infarction can alter ventricular activation and it produce left anterior left axis deviation. Okay, and it usually associated with old infarction and pathological Q waves. So pathological Q waves. We will discuss this thing when we are discussing about STEMI and progression of myocardial infarction. That time we will discuss about this pathological Q wave. Okay. Next, another pathological condition, that is congenital heart disease. So the certain congenital heart defects may produce left axis deviation. Example like endocardial cushion defect and atrial ventricular septal defect. Okay. Next, one more we have, that is ventricular paced rhythm. So patients with pacemaker may show left axis deviation because ventricular activation follows an artificial pathway. Okay, so this ECG findings in left axis deviation. The typical ECG findings include like lead 1 positive QRS, AVF negative QRS. So it may often like lead 2 may also be negative if the axis is less than minus 30 degrees. Okay. Why is LAD, that left axis deviation, is important? If you're seeing here in clinical example, you can see here, for example, a 68-year-old man with long standing of hypertension undergoes an ECG. So the findings, the lead 1 will be like positive and lead AVF will be like negative. So the tall R waves in V5 and V6, then we have to suspect patient have left ventricular hypertrophy with left axis deviation. Okay, so if R wave is in V5 and V6 is more, then we have to suspect patient have left ventricular hypertrophy. Okay, that thing also more than equal to 35 seconds. Okay, so that is we call left ventricular hypertrophy in left ventricular axis. Okay, so why is LAD is important? This left axis deviation itself is not a disease. It is a clue that may indicate an underlying cardiac condition such as like left ventricular hypertrophy, conduction defects, previous myocardial infarction, and congenital heart diseases. And always interpret left axis deviation with the patient symptoms and the rest of the full ECG. Okay, so we have some differential diagnosis. Whenever patient have left axis deviation, we have to look for additional ECG findings like tall voltage, left ventricular hypertrophy, wide QRS means bundle branch block, Q waves means old myocardial infarction, pacemaker spikes, that means paced rhythm. Okay, so in systemic ECG, whenever you are seeing any ECG, whenever you are doing interpretation, we have to see the axis and we have to look at lead 1 and lead AVF. So if lead 1 is positive and AVF is negative, then we have to think left axis deviation and we have to search for the underlying cause. Okay, so next you can see here, that is left axis deviation. The QRS axis will be like minus 32 minus 90 degrees. The lead 1 will be like positive and AVF will be negative. And the common causes we can see, that is like left ventricular hypertrophy, left anterior fascicular block, inferior myocardial infarction, congenital heart disease, and this left anterior fascicular block, one of the most common cause is ECG cause of left axis deviation. Okay, so in rapid revision, what is the range of left axis deviation? We have to always remember that is minus 30 to minus 90 degrees. The lead one positive and AVF will be negative indicates left axis deviation. The most common structural cause will be like left ventricular hypertrophy. The most common conduction cause will be like left anterior fascicular block, and inferior wall MI can cause um, left axis deviation. Okay, so today we learn how to identify the left axis deviation and its important causes. In day 12, we're going to learn right axis deviation and its ECG findings, causes, and clinical significance. So see you in the next ECG lesson on med steps by Dr. Anand. Okay, till the time, take care.